escucha y descubre información fantástica, belleza sin fronteras, consejos de primera. Sintoniza ya. Más que tu cirugía, tu podcast cada día.
I'm Lefny, I'm surgical coordinator. Today, in this new episode of Más que tu cirugía podcast, we have a guest that is plastic surgeon in the Dominican Republic, certified. He is Dr. Jose Mora. So we're going to speak some items that we want to talk also in Spanish. But I want to give you also the opportunity that when you come to Dominican Republic to travel abroad and get a plastic surgery, I want to let you know that we are a country that take very seriously the safe and the health of our patient and our guests. My patients are my honored guests, and it's very safe also to come to Dominican Republic. And we're going to talk about some themes that the best surgery that Dr. Mora does. And I hope that you enjoy this episode. I hope that you also comment, subscribe, and save this. Dr. Mora, welcome here.
Thank you for the invitation, Lefny. I try to speak in English. My English is not the best, but I try to speak English for all of us girls. We can start this reunion.
Great. So the first question, doctor, and I know that that several patients come from abroad and come for tummy taps. So let's talk about this. And the first thing with the tummy taps is the patient that comes for tummy tap, how long should stay in Dominican Republic when they come?
For all surgeries, I recommend 2 weeks after surgery. But for tummy tuck, if you can stay here for 3 weeks, is the best time for you to stay here. Because sometimes we remove the drain regularly, average, through 12 days. But sometimes depends, if you have too much fluid during your stay here, you can stay with the drain for a long time. I recommend you go home again when I remove your drains. This is the most important thing. But if you can stay 2 weeks after surgery, is a good time.
Great. So the first thing is that also I have this question is, what can I do if I want to get a surgery in Dominican Republic with Dr. Mora, for example? What's the step?
If you don't live in Dominican Republic, the first step is try to do the contact online. This is the first step. The contact online, you can do it through Lefny Beauty Consultants, or directly in my office. We do some question and we take pictures. When we have all the information, we do the pre-evaluation. This is the first step. When you have your quote and you have your deposit, the second step is do your blood test in your country before you come to this country, because sometimes your test is not good. In this case, you need try to fix it. All your lab test, and for you come here, okay? Anyway, when you come here, we do all the labs again, and you have the personal evaluation with me. It's the first one. The second evaluation is when I do your mark for your body and for your surgery.
It's very important what Dr. Mora explained, and you can, if you want an estimate quote, you can just follow my portal web in lefnydiaz.com, fill out the questionnaire. That is very important to know your health history, your picture, to see your body, your BMI, that we're going to talk about what is important, this theme. We have all-inclusive package for you, so you don't have to worry about nothing else, and you can just get the surgery stress-free. Our all-inclusive package usually have the surgery fees, The recovery house that we have also available, recovery houses are places that have nurse, staff, and equipment to take care of you. They are bilingual, they include the food. We have the transportation to pick you up from the airport and go to all the labs and evaluation and follow-up appointment that you need with your doctor that you choose. Also, we have the all-inclusive have the post medication, all the labs and evaluation that you need. But also you will have my company, my company to provide you the step-by-step, all the concerns that you need to have in a successful surgery in Dominican Republic with a right surgeon like Dr. Mora. So it's very important that. So you talk about something very important, and it's about the BMI. What's the limit of BMI to get a plastic surgery? For example,
Okay.
a patient that have a BMI of 40, but let's first start like, what is a BMI? That's the body index.
BMI is a percent of a equation from your height and your weight. We do a formulation about this with these parameters for you know how is your BMI. The normal BMI is between 22 to 24 of BMI. But we know when you have this BMI, you are a slim girl or a slim person, okay? Mm-hmm. For that reason, we have the limit for do surgery is 35 BMI. I recommend you have in 35 or less, because when you are under the 35, you have less risk for surgery. When you have more than 35, the risk is too high for you get that surgery.
So it's very important, that part, because we, and I say we because I'm part of the team, and all my surgeons that one is the safety of the patient and good results too. And what kind of evaluations you may before surgery, because it's not like you want to come and you're going to get surgery right away. You have some step first, and I want to know which one are.
What I do before you come?
No, when they come, they arrive, and
okay.
come right away to surgery?
The first days is for you do the cardiologist evaluation, pneumologist evaluation, is pulmonologist evaluation in the United States, labs, and you have one evaluation personally with me. This is the first evaluation. In this evaluation, I take pictures, I explain what I do during the surgery and what is the surgical plan. If you don't understand anything, I mark your body for you to understand me better. But the second appointment is the day of surgery. In this day, I do another evaluation. I explain again what we do during the surgery, and I mark your body. Mark your body for I know what I do in the operation room.
The surgery plan.
Yes.
Yes, surgery plan. So during this cardiologist evaluation, for example, and soon we're going to have a guest that cardiologist that's going to explain why it is so important, but now we're going to speak like what they look in this cardiologist evaluation and what they look in a pulmonologist evaluation.
The cardiologist evaluation, your evaluation is for check if your heart is in condition for you to take a surgery, and how long you are during the surgery under anesthesia, okay? Because if you want a surgery with long time, it's probably the cardiologists don't approve this surgery or approve less surgery than you want.
Less procedures.
Okay, less procedures, okay? And with pneumologist evaluation, you have two things. One is approve the test. If you don't approve the test, you cannot do any surgery. Sometimes you approve the test, but you are under the limit for do some kind of surgeries or procedures. For example, sometimes you approve the pulmonologist evaluation, but you cannot take the tummy tuck, but you can take the breast reduction, for example. Okay, mm-hmm. You need have a good parameters for you take a tummy tuck or abdominoplasty, because when we do the muscle repair, you have less less expansion of your lungs, and for that reason, you have a little bit difficult with breathe.
Yeah.
Okay?
Yeah, that's very important, and that's why you need to do the breathe exercise that we
very
also, talk about to get ready, because this is important. It's not just, okay, I want to get surgery, I'm going to Dominican Republic.
No.
You are welcome to come here, but in the right in the right things, to do the right procedures also for your safety, and you can enjoy your resorts too. So it's very important, that part. So doctor, we talked first about tummy tops.
Yes.
What other procedures you can mix with a tummy tops, for example?
Okay, for health ministry regulation, we can do it 2 major surgery and 1 complementary. 1 complementary is a minor surgeries, like, for example, scar plastic is when I remove the old scar and do again.
A revision of scar.
A scar of revision is a minor surgery, but it's a complementary in case you have 2 major surgeries. Or for example, BBL is a complementary procedure because we know if I do liposuction and I can use the fat immediately, I need to throw this fat to the waist, for example. But 2 major surgeries are tummy tuck is a major surgery, breast reduction is a major surgery, liposuction is a major surgery, brachioplasty or arm lift is a major surgery, inner thigh lift or
Thigh lift, yeah.
thigh lift is the major surgery. Okay, then you have to do the combination two surgeries of this for take a surgery, or the most ideal surgery is 1 surgery at a time, but it's more time, it's a little bit more expensive, okay, and it's a little bit more painful because you have more painful during every surgery.
That's
Okay.
right. That's very important in that part. So we're gonna finish right now this and we're gonna speak later in another episode in Spanish to talk again with Dr. Mora to more themes that you want to know to come to Dominican Republic. I specify tummy top because most of the patients that I know come for tummy top with you. But some patients come with, this little fat, because when they take the tummy top, they say that they have like a little pouch. What happened with that?
Okay, let me explain about this. First, the most frequent surgery in the world is the liposuction. Not complete liposuction, is liposuction in any kind of any part of your body. Is the liposuction is the most frequently. When we do the tummy tuck, almost ever we do combination tummy tuck and liposuction for have a better results, for better results in your shape and for better results in your belly, basically. Okay, but in the central part of your belly, we cannot do. Yes, in the central part we cannot do liposuction because when I do liposuction in this area, it's probably with the cannula we do damage in this area. If we do damage in the circulation in this area, later you will have problem in your scar or in your flap. In your flap is all the skin and fat in the central part of your belly. If you have problem in your flap, you will have probably necrosis. Necrosis is when the tissue is die, and is dead. And this is one of the worst complications in the tummy tuck.
Yeah, that's very important, and it's important that you educate about this because we don't want any complications. Complications in surgeries are normal worldwide. Talking about worldwide things, but during the if you do the right thing, you're gonna be just right.
Yes.
And if you follow the instruction from the doctor and the team, doctor team, because doctor doesn't work alone. He have the assistant, he have the medical assistant, he have his helper that during the surgery, anesthesiologists that all the time are also in surgery.
It's very important, how you resolve the complication, because in any moment the complication will be appear. When the complication is appear, we know how resolve this complication.
That's why it's important, the communication.
It's very important.
You cannot go and that's it, and
Yes.
then I have a complication, but nobody knows how we can
Yes.
help you. And this is not because you come to Dominican Republic. In everywhere that you decide to get a plastic surgery, you have to communicate on time. Do not dream it, do not suppose it, do not go to the social media to see if you see, a special thing remedy for your case. It's not like that. You have to go to your doctor, a responsible doctor. That's why it's important to choose wisely your surgeon before, because it's not just the resort. It's also the connection. It's also the communication. It's a lot of stuff that you have to take in mind before make this decision and choose a surgeon. And this is very important that you educate before, so you can know that you can have the tools to know if something happened, what I have to do, what's my next step. But we are a team that always work together, and we want the best for you. Doctor, I want to thank you to myself. I know
Thank
that
you,
is,
Levni, for the invitation.
I know that is was a very risky thing to talk in English with Dr. Mora, but I love because
It's very difficult for me, okay?
I know.
But I try.
But I really appreciate, and I know that all of you are going to appreciate that, because our main language is Spanish, and he feels very comfortable speaking Spanish too. But I want to show you that we want the best for our guests, and even that is not our first language and it's not our best either, we make the best to make you feel like home in Dominican Republic too. So I hope you enjoyed this episode. If you want an estimate again, just visit lefnidiab.com. Follow my Instagram page in Lefni Beer Experience. Dr. Mora is _Mora. Yeah, Mora is underscore. It's right. In Instagram too. And we're gonna be just. We're gonna be an honor to help you to this process that come to Dominican Republic to have a safe plastic surgery with great results too. So until then, again, thank you to be here. Thank you, Dr. Mora.
Thank you, Levni. Thank you.
And see you in the next episode.
Bye, girls.